Hi there and welcome to the Roadmap to Medicare webinar. My name's Chet Kuhn and I'll be hosting the webinar today. And I'm excited that everyone is here because we're going to cover a lot of great information. This is my favorite event that I do all year long. I have a passion for helping make Medicare easy to understand for those who are new to Medicare because it really can be made simple. So you're in the right place if you're turning 65 or new to Medicare. All the information we're going to talk about in the next 45 minutes is going to be designed just for you to help you understand what your future Medicare coverage will look like. And we'll talk a little bit more about each step in the enrollment process and how to find the best coverage for you. Now, my goal today is to make Medicare easy. Like I mentioned, we're going to be talking in clear and simple terms. They're easy to understand without all of the confusing language that insurance companies use. This information is all about you, helping to make Medicare as easy as possible. Now, we're going to cover 5 important things today. First, we're going to talk about the ABCs of Original Medicare: what it is, what it covers, and how much it costs. Next, we're going to talk about what your coverage options really are. So we're going to talk about Medicare supplement plans, Medicare Advantage plans, prescription drug plans, and more. So we're going to talk about what all of your coverage options are, not just the ones that the insurance companies want to sell you. Next, we're going to talk about how to select the right plan for you based on your needs, your budget, and what you want. And finally, we're going to talk about how to pay less and get more for your Medicare coverage by easily comparing plans to find the best deal, and most importantly, knowing what to look for in your new coverage. We're going to share some expert tips on how to find the best coverage for the lowest price. Now, you're also going to want to make sure you stick around until the end of today's webinar because we're going to be giving away a free downloadable copy of our Stress-Free Guide to Medicare ebook. That's a free downloadable ebook that contains a lot of helpful information, and you'll also get a copy of the replay video from today's webinar so you can review all of the information that we're going to cover. So make sure and stick around until the end so that you get those free goodies. I know you'll find those helpful. Now, I want to get started by telling you a quick story and giving you a little bit of background about myself and my company, Medicare Hero. Now, my name is Chet Kuhn, and I'm a licensed insurance agent. Over the past 15 years, I've helped thousands of people all across the country with their Medicare coverage. And today, I run a company called Medicare Hero. Medicare Hero is a family-owned insurance brokerage that was established back in 1985 by my father, Morris Kuhn. And from the very beginning, he designed our company to be an unbiased resource that could help our clients shop to find the best coverage available among all the top insurance companies. Today, we're contracted with more than 30 of the top insurance companies in the Medicare market, and we help our clients shop among all these companies to find the best plan for them. So the most important thing here is, while we are contracted with more than 30 of these companies, we work for you. What we do is we help our clients shop for Medicare supplement plans, Medicare Advantage plans, prescription drug plans, dental, vision, and more. Pretty much anything you might need help with regarding Medicare, we can help. So it makes us an unbiased resource because it does not matter to us what type of coverage or which company you enroll with. All we want is to help you find the plan that you're looking for. We can help you by giving you personalized Medicare guidance. We can help you compare plans for the top companies and find the best prices available. We can assist you with your enrollment paperwork, make your life really easy when it comes to signing up for Medicare. And for all the clients who sign up for Medicare Hero, we provide lifetime service and support. That means you'll never be alone when it comes to your Medicare coverage. Whether you have a simple question, need help finding a doctor, or need help filing a claim, you can always give your team at Medicare Hero a call and speak to a live person directly. You don't have to worry about sitting on hold for a 1-800 number at an insurance company. We're always here to help. Now, the best part about all the help that we provide to our clients is that our services are completely free. That's right, our services are completely free. Medicare Hero is paid by the insurance company you choose when you enroll through one of our agents. So it truly doesn't matter to us which company you choose. Our only interest is helping you find the best coverage for your situation. So if you need any help at all, if you have any questions during the webinar or after the webinar, feel free to give us a call. We're here for you. Okay, so now that I've told you a little bit about our company at Medicare Hero and how we can help, let's go ahead and dive right in and start talking about Original Medicare. Now, Original Medicare is going to form the foundation of your Medicare coverage. This is the coverage that we build upon by adding a Medicare supplement, Medicare Advantage, or prescription drug plan, but we have to have Original Medicare before we do anything else. Now, Original Medicare is comprised of two parts. The first part is called Part A, which is known as your hospitalization coverage. Part A of Original Medicare covers everything basically inside of a hospital, skilled nursing facility, rehab facility, nursing home, hospice, things like that. So Part A covers inpatient hospital or other facility-based care. Now, the premium for Medicare Part A is typically free. As long as you or your spouse have paid in your FICA taxes and worked for at least 10 years, then your Part A premium is free. Good little rule of thumb is that if you're eligible for Social Security benefits, then you're most likely eligible for Medicare Part A at no cost. The next part of Original Medicare is called Medicare Part B, also known as typically as your major medical or your doctor coverage. This basically covers everything outside of the hospital. So this is going to cover your doctor's visits, your outpatient care, lab tests, x-rays, blood work, preventative services, things of that nature. So Part B of Medicare is really the big one. That's what we use most often. And Medicare Part B does have a premium based on your income. Now, the way that Medicare calculates your income to find your premium level for Medicare Part B is based on your tax return 2 years prior to the current year. So in 2021, they're using your 2019 tax return to calculate your income. So let's talk a little bit about how much your premiums would be. As long as you make less than $88,000 per year as an individual, or $176,000 per year if you file your taxes jointly, then you'll just pay the standard base premium for Medicare Part B of $148.50 per month. Now, that's the vast majority of individuals fall in this category, so most people will pay $148.50 per month for Medicare Part B in 2021. If you have a higher income above those two numbers, then you're going to use the following chart to calculate your premiums. I'll put a link off to the right side of the screen where you can download this chart to view later on. But essentially what you'll do is you just take your tax return, whether you're filing an individual tax return in this column on the left or a joint tax return in this column on the right. You just go down, you find your income level or the income level appropriate to your tax return, again, 2 years prior to the current year. So in 2021, we're using our 2019 tax returns. You just come across the screen to the right-hand side, and you will find your Medicare Part B premium if you pay a higher premium based on that higher income. So now that we've talked a little bit about Part A of Medicare and Part B of Medicare, let's talk now about what that coverage actually looks like when you go to use it at the doctor or the hospital. So if you only had Original Medicare and no other coverage, this chart shows you what you would owe. So if you only had Original Medicare and you went to the hospital, you would owe a $1,400 deductible day one. And then depending on your hospital stay and how long it was, you could owe tens of thousands of dollars more depending on how long that stay was. Now for Medicare Part B, you're going to owe a flat 20% of all of your Part B medical bills. That's a big one. Paying 20% of our medical bills is really not affordable at all. So what I typically use here is the example of a heart attack. The average claim for a heart attack is around $100,000. So if you only had original Medicare, you could owe up to $20,000 for that one claim. Now, there's one other column to the right, a little known thing called excess charges. Excess charges are an additional 15% that some doctors are allowed to bill on top of what Medicare pays them, and they're allowed to bill that 15% directly to you. So in actuality, you could end up paying, if you went to a doctor that charged excess charges, up to 35% of the bill for your Part B medical expenses, which is just astronomical. So that really shows why original Medicare is great as a foundation to your coverage, but it's not complete medical coverage. That's where we have to talk about next, choosing a path on how you would like to receive your Medicare benefits and how we would like to cover these expenses. The good news is Medicare's given us two great options, different solutions for how we're going to cover all of the expenses on this page, or at least make them significantly more affordable. Okay, so now that we've talked a little bit about original Medicare, what it covers and how much it costs, next I want to talk about your Medicare enrollment, and specifically, how do we apply for original Medicare? Well, applying for original Medicare depends on one of three different scenarios. So the first scenario is, if you're turning 65 and you are receiving your Social Security benefits prior to your 65th birthday, then you're going to be automatically enrolled into original Medicare, and they're simply going to mail you your red, white, and blue Medicare card in the mail about 4 months before your birthday. Couldn't be easier. Now, the second scenario is, if you're turning 65 and you are not receiving your Social Security benefits, like many people these days, if you're delaying your Social Security benefits till you're 70 or until you're 66, then you will not be enrolled into Medicare automatically. It's not a big deal. You just simply need to let them know that you want to sign up for Medicare when you turn 65. So you just need to do a quick online application. You can apply for original Medicare 3 months prior to turning 65. And the easiest way to apply is right online at Social Security's website, which is ssa.gov/Medicare. Okay, the third scenario is, if you're over 65 and you're leaving your employer coverage to join Medicare, then you're going to have to do a little bit of a different process. So you're going to need to submit a paper application. So if you're over 65 and you're now retiring and planning to join Medicare, you're going to need to do a paper application along with a proof of coverage form. Those two forms together will be your application for Medicare. You can submit those applications 3 months prior to leaving your employer coverage. And you can send those applications to your local Social Security office. You can find the application and the proof of coverage document on our website. And don't worry, the applications are real short. They're less than a half a page long each. Okay, so next let's talk about what your coverage options really are with Medicare. Now, I like to use an analogy here. So imagine you're walking through the woods and you come to a fork in the road, and you have two distinctly different paths you can choose on how to get to your destination. That's essentially how Medicare coverage works. So you have two distinctly different paths you can select between on how you like to receive your Medicare coverage. The first path that we're going to talk about are called Medicare supplement plans. Now, Medicare supplement plans are designed to fill the gaps in original Medicare. Medicare supplement plans pay the copays, deductibles, coinsurance, excess charges, all of the expenses left behind by original Medicare. Essentially, a Medicare supplement plan turns your red, white, and blue Medicare card into 100% coverage anywhere Medicare is accepted. It's fantastic coverage, and it's the highest level of coverage available for Medicare beneficiaries. Now, with Medicare supplement plans, this is really important. There are no networks. You can use any doctor or any hospital that accepts Medicare regardless of which company you have your Medicare supplement plan through. So if you have Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, it doesn't matter. You can simply see any doctor or any hospital that accepts Medicare. That's a really important point, and it's one of the hardest points for us to digest sometimes because pretty much during our whole life we've had to use networks for our health insurance. So Medicare supplement plans have no network. You can go to any doctor that accepts Medicare. Additionally, there's no referrals required in order to see a specialist. You can go directly to any specialist as long as they accept Medicare. And they provide nationwide coverage. So a Medicare supplement plan works just as good in Hawaii as it does in Alaska or Texas or Arizona. So if you're traveling and you're in a different state, you have full access to your health care coverage. God forbid if you were diagnosed with a major illness, such as a rare form of cancer, and you wanted to travel across the country to see the best Medicare or the best cancer specialist in the country, you could do that as long as that doctor accepts Medicare. There's no restrictions. It is nationwide coverage. Medicare supplement plans also have a simple claims process. Medicare and your insurance company automatically coordinate to pay your bills, so you don't have to pass bills back and forth. It's a very smooth process. Medicare supplement plans are also guaranteed renewable. So once you have a Medicare supplement plan, you can never be dropped or canceled from your plan for any reason. So once you have one, you're kind of locked in. You can keep that Medicare supplement plan forever as long as you pay your monthly premiums. Now, here's 3 key points about Medicare supplement plans you're definitely going to want to know. First, all Medicare supplement plans are standardized. So these plans are named with letters such as Plan G or Plan N. Now, Medicare named these plans with letters, and they require insurance companies use those exact names in order to make it easy for you to shop for the best price. Because while all companies offer identical coverage for a particular plan, the prices can vary from company to company. So you know if you see a Plan G offered by Mutual of Omaha or Aetna or United Healthcare, that is the exact same Plan G coverage, no matter who offers it. Next, every insurance company must offer identical coverage. So you don't have to worry about whether the Blue Cross Blue Shield Plan G is going to offer you extra benefits over the United Healthcare Plan G. They're exactly the same. It's required by law. So Plan G is Plan G no matter where you get it. Doesn't matter which insurance company you have. A given plan is always the same no matter who you purchase it through. So that's really important. And Medicare supplement companies have identical networks, just like we talked about. Doesn't matter. Again, it doesn't matter if you get your Plan G through Blue Cross Blue Shield or United Healthcare or Manhattan Life. You can simply go to any doctor that accepts Medicare. Now, when you're initially enrolling in Medicare for your very first time, you get a one-time free pass to get any Medicare supplement plan you wish. No questions asked. No pre-existing conditions. You can get any plan you want. Now, if you wait and maybe try to get a Medicare supplement plan a year or 2 after you've been on Medicare, then at that point, insurance companies are allowed to ask you a few health questions, and it's not a type of insurance that we're guaranteed to get. It's kind of like life insurance. You have to pass a few health questions in order to qualify. But you do get that one-time free pass when you're new to Medicare for the first time. So it's important that if you ever think you're going to want to be on a Medicare supplement plan, go ahead and start with one from the very beginning, because that's the only time you're really guaranteed to be able to get a Medicare supplement plan, is when you're new to Medicare for the very first time. Now, let's take a quick moment and talk a little bit about how to find the best Medicare supplement plan and how to know which one is going to provide you with the best value. Now, as we spoke about, Medicare pre-designed 10 different Medicare supplement plans that they allow insurance companies to sell. Now, in the past, the highest level of coverage available was offered by a plan called Plan F. As you'll notice in this column right here, Plan F simply covered 100% of all services covered by Medicare. What that means is Plan F simply turns your red, white, and blue Medicare card into 100% coverage anywhere Medicare is accepted. It's just that simple. There's no copays, no deductibles. You pay your monthly premiums, and that's it. Now, currently, Plan F is being phased out. So if you're joining Medicare after January 1st of 2020, then Plan F is no longer going to be available to sign up for. Now, don't worry though, that's not a bad thing, because we've been helping clients avoid Plan F for years. Plan F has been overpriced and outdated for years, and so we have very, very, very few clients who ever took Plan F, and so I want to focus in now on the two best options available. So currently, there are two Medicare supplement plans that are by far the most popular today. These plans are called Plan G and Plan N. So let's take a quick look at these two most popular Medicare supplement plans, see what the differences are, and which one ends up being the best value. So first, I want to start by talking about Plan G. With Plan G, you'll notice everything in the column listed here is 100% covered except for just one item, and that is a small annual deductible that you'll pay out of pocket that is currently $203 per year. So with Plan G, after you meet that small annual deductible of $203, Plan G provides 100% coverage for any service provided by Medicare. So anything that your red, white, and blue Medicare card covers is 100% covered after you meet that small annual deductible. With Plan N, there's just a few key differences. So with Plan N, you'll also pay the exact same $203 annual deductible. But then there's also another few costs remaining with Plan N that you'll have to pay out of pocket. First is with Plan N, in addition to the deductible, you'll also have to pay a $20 copay at each doctor visit and a $50 copay for an emergency room visit. So those aren't too bad as long as we could save enough money. Those aren't too big of a deal, but you will have those copays in addition to your deductible. But now here's the big thing that Plan N doesn't cover that a lot of people don't talk about, and it's really a pretty serious item. And that is Plan N does not cover excess charges. So what that means is, as we talked about in the beginning of the webinar today, some doctors can reserve the right to charge an extra 15% on top of the bill that Medicare approves, and they send that 15% bill directly to you. Now, while we don't see doctors charging excess charges very often, when we do see excess charges charged, it's typically from high-end specialists or surgeons, and so 15% of the bill from a high-end specialist can be thousands of dollars. So when you do come across excess charges, it is a very expensive ordeal typically. So at the end of the day, in order for Plan N to be a better value, we'd have to be able to save a pretty substantial amount in premiums to offset those copays we have to pay at our doctor's office and at the ER, in addition to taking on that added risk of potentially being charged up to 15% excess charges. And the problem is, in most areas and in most cases, Plan N is a very minor savings over Plan G. Typically, the difference in cost is maybe $10 or $15 a month. So for that reason, Plan G is most often the best value Medicare supplement plan available. It gives you the most coverage for the lowest cost. Okay, so now that we know that Plan G is typically the best value among the Medicare supplement plans available, I want to give you a couple of quick money-saving tips that could save you thousands of dollars on your Medicare supplement plan, simply by teaching you how to shop for your coverage the smart and easy way. Now, as we spoke about before, every company offers identical coverage. All the coverage that these companies offer is apples to apples. But the one thing that changes between these companies is the price that they charge for their coverage. So for the exact same Plan G coverage, insurance companies can charge wildly different prices. Now, if you're like most people, then you're probably wondering at this point, why would companies charge different prices for the exact same coverage? Something doesn't add up. Well, that's a great question, and here's why. So there's three primary reasons. First, people simply don't shop around. That allows insurance companies to charge higher prices simply because they know many people aren't going to shop around and check to make sure they're getting a good deal. Second, many people don't know that all Medicare supplement plans are standardized and all of the coverage is identical. So many people mistakenly think that the lower premium available by a different company comes with less coverage, when that's simply not true. And then third is many people mistakenly think that networks still apply. It's these simple, common misunderstandings about how Medicare supplement plans work that end up costing people the most money. So doing a little bit of research on your coverage before you go shopping can definitely save you a lot of money in the long run. So now that we know that all Medicare supplement plans are the same and that we're out on a level playing field, let's talk a little bit about what you should look for when you're shopping for a Medicare supplement plan. So first, and the most important thing to understand is what your prices are actually based on. So when you get a quote, your prices are based on your age, your gender, where you live, and other discounts. So just because one company is the most affordable for a 70-year-old male in Arizona doesn't mean that the same company is going to be the best for a 65-year-old female in Florida. So it all depends on your specific situations as to which company is going to be the least expensive. Now, these quotes over on the right-hand side are not real. They're just example quotes that we made up. But it's a really good point where we work with 30 different insurance companies, and it's not because we want to. It's because it 100% depends on these four factors over here: your age, your gender, your location, and discounts, as to which one of the companies is going to show up being least expensive for you. So you always want to shop and just don't sign up with the company that your friend got the best price with, because they might have a little bit different of circumstances than you do. So next, what do we want to look for when we're applying or when we're looking at companies? First, we obviously want to look and make sure we're getting a fair price since the coverage is the same. But more importantly, we also want to check the rate increase history of the company that we're looking at. We want to make sure that we get a fair price to start with, and we have a company that has a track record of not raising rates much from year to year. Now, with all Medicare supplement plans, your rates will go up a little bit after most birthdays. The average rate increase for Plan G is around 2% per year, so it's just a few dollars. So getting with a good company can really not only save you money from the start, but it can save you even more money in the future by getting a company that's not going to raise our prices much. Now, if Medicare supplement plans sound like a good fit for you, and if you'd like to get your free rate comparison, then just let us know, and we'd be happy to send you over a side-by-side rate comparison of all the top companies in your area. We can not only give you the prices like we mentioned, but the rate increase history, financial ratings, and insight from other customers who've been enrolled in your area and their experiences with different plans, so that you can make a good decision and pick a good Medicare supplement company and plan for the long run. So what I'll do is I'll put a little button up here on the screen where you can request that rate comparison, or just give us a call after the webinar and we'd be happy to give it to you right over the phone. Okay, so that wraps up Medicare supplement plans. So now let's talk about your alternative. the other path that we can choose when we join Medicare. So we got to make a clear distinction here because we're going to talk about a completely different type of insurance, and it works completely different from Medicare supplement plans. So let's set everything we just talked about aside, and now we're going to be talking about Medicare Advantage. So Medicare Advantage plans, which is also known as Part C of Medicare, if you've heard that anywhere, but in the real world they're just called Medicare Advantage plans, are an alternative to original Medicare. Now, Medicare Advantage plans do not supplement your original Medicare, they actually replace your original Medicare. So you still have to pay the premium for original Medicare, and you'll still have the red, white, and blue Medicare card. It just won't do anything when you go to the doctor or the hospital anymore. You're turning all of your healthcare coverage over to a private insurance company. Now, the way that I think about Medicare Advantage plans is it's as if I walked into the Medicare office and said, "Mr. Medicare, I would be willing to trade in the benefits of my red, white, and blue Medicare card if you'll buy me a private health insurance plan like I had during my working years." So Medicare Advantage plans are sold and run by private insurance companies, the very same companies you're familiar with, like Humana, Aetna, United Healthcare, and so forth. These plans combine your doctor, hospital, and prescription drug coverage all into one plan. So it's very similar to the coverage that you might have had through an employer or individual health insurance you've had in the past. Now, Medicare Advantage plans were designed as a lower priced alternative to original Medicare and a Medicare supplement plan. And so when I say lower price, what I really mean is a lower monthly premium. So Medicare Advantage plans typically offer a lower monthly premium than a Medicare supplement plan. So let's talk a little bit more about how they work and a few really important points. So first of all, networks typically are required for doctors and hospitals with Medicare Advantage plans. So typically you have to stay in your plan's network. Now I'd like to take this moment to clarify a common misconception. See, the same companies often offer Medicare supplement and Medicare Advantage plans. Let's just pick on United Healthcare, for example. Now, as you may remember, Medicare supplement plans have no network. So if you have a United Healthcare Medicare supplement plan, there is no network and you can go to any doctor, any hospital that accepts Medicare. But if you have a United Healthcare Medicare Advantage plan, then you do have a network and you'll have to stay within that network. So that's a really important point. It's commonly confused that the network restrictions are for Medicare Advantage plans. With Medicare Advantage plans, you also have copays, deductibles, and other out-of-pocket expenses when you use your coverage. So you save money in monthly premiums, but you have more expenses when you actually use your coverage. And finally, Medicare Advantage plans can change each year, including the benefits, copays, the network of doctors, and more. So with Medicare Advantage plans, one of the keys to success is you really want to stay on top of your coverage and review it each and every year to make sure that your current plan is going to meet your needs for the next year, that your doctors are staying in network, and that your prescriptions are still covered. So just keep an eye on your Medicare Advantage plan and review it each and every year to make sure it's still going to fit your needs. So now that we know what Medicare Advantage plans are and how they work, next, we want to talk about what to look for in a Medicare Advantage plan when you go to shop for coverage. So if you remember back when we looked at Medicare supplement plans, all of the benefits were apples to apples between every single company, so it was easy to compare plans. With Medicare Advantage plans, unfortunately, it's not so easy. So what you'll find when you start looking at Medicare Advantage plans is that the benefits, copays, and monthly premiums, in addition to the network of doctors, will all be a little bit different between companies. So it's really easy to start feeling overwhelmed by looking at all the numbers and trying to figure out which plan is best. So unlike Medicare supplement plans that were all apples to apples, these Medicare Advantage plans are more like apples to watermelons to oranges to bananas. It's just hard to compare them. So let me give you a few really important tips on what to look for in a Medicare Advantage plan that'll help guide you to the plan that's going to be the best fit for you. So what should we look for in a Medicare Advantage plan? There are four important things that are going to guide you to finding the right Medicare Advantage plan. First is the monthly premiums. The primary benefit of a Medicare Advantage plan is lower monthly premiums. So you want to make sure your premium is affordable. Typically, my recommendation is some Medicare Advantage plans have a zero premium where you don't pay anything extra in addition to what you pay for original Medicare. Other plans can go upwards of over $100 a month. If you're getting to a premium that's more than about $50 or $60 a month, then at that point I highly recommend you switching gears and looking towards a Medicare supplement plan. The reason being is we need to save enough money in the premiums to be able to pay those co-pays, deductibles, and other out-of-pocket expenses when we use our coverage. Otherwise, it's just going to end up costing us more. So make sure your premium is reasonable and low, so you're actually saving money each month to put towards those co-pays and other expenses. Second is your network. Because you're going to have to use a network of doctors and hospitals, you're going to want to make sure that your current doctors that you like and want to continue to see are still in network with the plan that you're looking at. Third is your medications. Now, prescription drug coverage is something we're going to get into a little bit more here in just a minute, but your prescription drug coverage will likely be built into your Medicare Advantage plan that just kind of packages everything together. So if you take some prescriptions, you want to make sure that those prescriptions are covered and covered for a reasonable copay. There's nothing worse than finding a great healthcare coverage and realizing your prescriptions aren't covered or they're covered for a very high cost. So check on your medications. Now, at this point, about 98% of my clients have made a decision on which Medicare Advantage plan is best based on these first three things. Now, the last option or the last thing we want to look into as a last resort is the copays, deductibles, and other benefits of the plan. The reason I say that's typically a last resort is because it's very easy to get lost in the weeds when we start comparing benefits. Because where one company might have a $5 lower copay at your primary doctor, the next company might save you $5 at a specialist. So it's very hard to compare plans, and they're typically within a few dollars of each other in the copays. So that's why I typically say leave the benefits as the last resort, because that's what gets people feeling overwhelmed and confused. Focusing on the premiums, the networks, and your prescription drug coverage will likely help you find the right plan just between those three. So we've covered a whole lot of information. That wraps up Medicare Advantage plans and Medicare supplement plans. And I know I've given you a lot of information, and you're probably wondering, Chet, how in the world do I decide what type of coverage is best for me? Well, if you're not already leaning one direction or another, I'll give you a little bit of an overview summary here, just to quickly recap what your options are and which type of coverage is best for which type of people. So, how I decide what type of plan is the best value for me. So starting off with Medicare supplement plans, as a quick recap, monthly premiums for Medicare supplement plans range from $85 a month to $150 a month, just depending on your age and where you live, your gender, things like that. Most people who are turning 65 find a plan for right around $100 a month or a few dollars more. Network. Medicare supplement plans have no networks, so you can go to any doctor, any hospital, anywhere in the country that accepts Medicare. You have the freedom to choose your providers. Out-of-pocket healthcare expenses. There are no copays. With Plan G, there's just that small $198 deductible once a year. Other than that, you just pay your monthly premiums and all of your healthcare expenses are covered. So there's no major out-of-pocket expenses to worry about. And then finally, the Medicare supplement plans are really the best option if you value your choice of doctors and hospitals and you like a predictable healthcare budget. Because your $198 deductible is really the biggest out-of-pocket healthcare expense you'll have during the year, you can pretty much bank on your monthly premiums for your plan being your healthcare expenses. There's no surprise expenses of $1,000 or $2,000 for your, normal healthcare expenses. Next, let's talk about Medicare Advantage. So Medicare Advantage plans, the biggest advantage of Medicare Advantage plans is lower monthly premiums. So some plans have a zero premium up to maybe $60 or so. So that's one advantage if you're looking for the lowest premiums possible. Networks. Networks are usually required, and referrals may also be required when you see a specialist. So if you're okay working within a network of doctors, then that's a big plus towards the Medicare Advantage plans. Out-of-pocket healthcare expenses, deductibles, co-pays, co-insurance. You'll pay all of these things out of pocket when you use your coverage. So Medicare Advantage plans, you're saving money on monthly premiums, but it costs more when you use your coverage. So if you're not using your coverage very much, you'll likely come out a little bit ahead with a Medicare Advantage plan. If you have some big medical bills, or you see the doctor frequently, or you foresee anything, surgeries or anything like that coming up in your future, then likely you'll want to be on the supplement plan. If you don't see anything coming up, then Medicare Advantage plans can be good. So to recap Medicare Advantage plans, they're really the best option if you value the lowest monthly premiums possible, and if you don't mind using networks of doctors. So that's kind of a good side-by-side comparison. There's no one best plan for anyone. It's all about what fits your needs, your budget. So if you have any questions, I know this is a lot of information, you can always feel free to give us a call after the webinar today, and we'll be happy to answer any questions for you. All right, so the last important topic that I want to talk about today is prescription drug coverage, also known as Part D. Part D is just what they call prescription drug plans, just another term for it. So there are two different ways you can get prescription drug coverage. If you choose to enroll in a Medicare supplement plan, then you can pick any Medicare supplement plan you want independently from your standalone prescription drug plan. So you can pick a Medicare supplement plan from Aetna and a prescription drug plan from United Healthcare, or vice versa. So you can kind of mix and match to get the best independent deal on both of your types of coverage. Now, alternatively, if you get a Medicare Advantage plan, then it's just going to be all combined together. And so you'll just pick the Medicare Advantage plan that covers the doctors that you want to see for the benefits that you want, and includes the drug coverage that you need to cover your prescriptions. It's just kind of a package deal. Whichever way you get it, if you get a standalone drug plan or built into a Medicare Advantage plan, essentially the drug coverage works nearly identical. So the way that the coverage works is the same. It's just whether it's a standalone separate plan or built into a Medicare Advantage plan. So prescription drug coverage is a very personal thing, and choosing your prescription drug plan is very personal to you. Here's why. So each drug plan is as unique as you are. Each plan has a monthly premium. Most plans have a premium of around $15 to maybe a little over $40 a month. They can go higher than that. The average premium is around $30 a month, so they're not too expensive. Now, each plan covers different medications. That's really important. And also, the plan can charge different copays and deductibles for those medications. So which plan is best for you is 100% dependent on which medications you take. Drug plans are an annual commitment, a calendar year commitment. What that means is you're guaranteed to be able to switch your prescription drug plan or your Medicare Advantage plan each and every year. But your plan can also change each and every year, like we talked about with Medicare Advantage plans earlier. So at the end of each year, your plan has the opportunity to change its benefits, premiums, copays, and the medications that they cover. So you'll want to review your prescription drug coverage at the end of each year and just make sure it's still going to cover your medications for the next year. And if you're prescribed any new medications, you'll want to make sure that those are covered as well for the next year. Now, all of these changes are made during what they call the annual enrollment period, which runs from October 15th to December 7th. The annual enrollment period is the time when you can elect to make a change in your coverage for the next year for prescription drug plans, and Medicare Advantage plans. Okay. Any coverage that you elect to change for the next year will start on January 1st. So you pick your plan between October 15th and December 7th, and then that coverage starts on January 1st. Now, during the annual enrollment period, you're guaranteed, no questions asked, to be able to switch your prescription drug plan to any other drug plan you want. So that's important because when you go to shop for a drug plan, you really just want to focus on which company and which plan is going to cover your current medications for the best price. Because we can always update your medications the next year and make sure that we're still on the best plan. So, the best drug plan for you depends entirely on your medications. It's a very personal thing. The good news is there's a really simple online tool that'll help you find the best plan. Just trying to understand and calculate how these plans work and premiums and copays and deductibles, it will drive you into the ground. You'll get into the weeds and it's just far too confusing. But these online tools, you can enter your medications and it will actually calculate which drug plan is going to save you the most over the course of the year. And 9.5 out of 10 times, the plan that these tools recommend is the plan that I recommend to my clients. It's very simple. Okay, so there's two tools I'm going to tell you about. The first one is a tool that we have available called Simply Enroll. Okay, this is an online tool where you can go and you can enter your current medications and your preferred pharmacy that you like to use, and it will calculate your prescription drug costs among all the plans available and order them from least expensive down to most expensive. Now, a few key benefits about Simply Enroll is when you're new to Medicare for the very first time, Simply Enroll allows you to save your progress, save your prescription drug list, save your favorite plan so you can revisit it later. That's going to be really important. I'll tell you more about that here in a second. If you find a plan you like on Simply Enroll, you can click Enroll Now and Simply Enroll online. We can help you with that as well. We can guide you through it. We're really familiar with it. It's a very good process, very easy. You can do it even right from your phone or tablet. Also, there's a physician network tool if you're looking up Medicare Advantage plans. So you can look up prescription drug plans or Medicare Advantage plans on Simply Enroll. And if you're looking up Medicare Advantage plans, remember those, we want to make sure our doctors are in network. It's got a tool built right in that'll show you how to look up your doctors and check if they're in network with each plan. So that's a great benefit as well. Now, the only downside to it is this is a program that we're bringing available, and insurance regulations are very strict. And so this tool is not available in all areas. We're getting it approved in more states every month. But if it's not available in your area, then I want to tell you about a second option for another great tool that you can use. But in order to go to Simply Enroll and to use this tool, simply go to shop.medicarehero.com. So you'll see at the bottom left side of the screen, the website address is shop.medicarehero.com. And that'll take you right to Simply Enroll. Now, after the webinar, I'm going to send you some additional content and videos, helpful things, and we'll have another video that will actually walk you through exactly how to use it, and we'll walk you through step by step. The other tool that you can use is the Medicare.gov Plan Finder. Now, this is the tool we've used for decades. Now, at the beginning of 2020, or actually at the end of 2019, Medicare released a brand new plan finder, and it's had some pretty serious growing pains. And so with accuracy and different things, there's been some errors in the numbers. So if Simply Enroll is available, that would be my first choice, just for accuracy and ease of use. But Medicare is a great alternative if Simply Enroll is not available where you're at. So Medicare.gov Plan Finder allows you to shop for plans based on your current medications and your preferred pharmacy, just like Simply Enroll. Now, there are some important notes with the Medicare Plan Finder. When you're new to Medicare, the very first time, like if you're turning 65 or if you haven't signed up for Original Medicare yet, in order to save your progress, you have to have a Medicare claim number which means you must have already signed up for Medicare and they have to process your enrollment and you have to be in the system. And you have to have a login to mymedicare.gov. So if you don't have a mymedicare.gov account, or you haven't gotten your red, white, and blue Medicare card in the mail yet, you're not going to be able to save your progress, which is a big downside, because you'll definitely want to revisit that information later. Now, Medicare.gov is available in all areas, so this is kind of a good backup when Simply Enroll, when Simply Enroll is not available. You can find this the Medicare.gov plan finder at medicare.gov/plan-compare. So you'll see at the bottom left side of your screen, it's medicare.gov/plan-compare. And again, I'm going to send you an email with a link to a really helpful resources page that's going to have all this information, the links and videos on how to use all this stuff. Now, for those of you out there who may not be taking any prescriptions currently, you may be wondering at this point, Chet, if I don't take any medications, do I still need to get a drug plan? Well, the simple answer is yes, because Medicare has a penalty if you go without drug coverage. So essentially, Medicare would charge you 1% penalty for every month that you go without credible drug coverage after you turn 65. So if you, let's say you turn 65, you signed up for Medicare, but you opted out of a prescription drug plan for 1 year. And then the second year, you decided to go ahead and get a prescription drug plan. Medicare would add an extra 1% penalty for every 1 month you went without drug coverage. So that would be a 12% penalty added onto your future premiums that you would pay for the rest of your life. So given the fact that the prescription drug premiums are the least expensive plans, depending on where you live, are typically only maybe $15 to $20 a month in premiums, it's not worth paying that penalty for the rest of your life just to save a few dollars a month. So I would highly recommend going ahead and getting a prescription drug plan. Now, if you have credible prescription drug coverage through an employer or union, like if you're continuing to work and you're delaying your Medicare coverage, then there's no penalties. All they're saying is there's a penalty if you have no type of credible prescription drug coverage once you turn 65. All right, so believe it or not, that wraps up today's webinar. Thank you so much for coming. I know we covered a lot of information, and I sure hope you found it helpful. As a thank you for sticking with us till the end, I'm going to send you an email here in just a few minutes with a copy of our Stress-Free Guide to Medicare, which is an ebook that we put out with just a lot of helpful information. As well as in that same email, you're going to get a copy of the replay video so you can watch this webinar again at your leisure and kind of review any spots that you may want to look at a second time. So let's talk a little bit about what the next steps are that you can take in order to keep your Medicare enrollment process moving along. Now, these are some great steps that you can take whether you're currently in your enrollment period or you plan to join Medicare in the next 6 months or year. Because what I find is, especially after this webinar, you've invested some time and effort into your knowledge of Medicare, and it's best to keep that process moving forward than start all over again in 6 months when we've forgotten everything that we learned. So here's some great steps for you. First, what you want to do is you just want to get answers to all your remaining questions. As I mentioned, we're going to send you that email with the Stress-Free Guide to Medicare and a replay of this webinar. There's going to be a lot of other helpful resource links in there, so you can use the information in that email, so keep an eye out. You can also find a lot of helpful information on our website, which is MedicareHero.com. So go there if you're looking for some more generalized information. Also, just feel free to give us a call. We're a family-owned insurance agency. We're happy to help you right over the phone, answer any questions you have. That's really the quickest way to get the most direct answers, is just to give us a call, or you can also shoot us an email at help@MedicareHero.com, and we'd be happy to answer all those questions for you. We can also help you get your side-by-side rate comparison, because what you're going to want to do after you get your questions answered is start looking at coverage and find out which plan is going to be best for you. So we'll be happy right over the phone or email. We can send you a side-by-side rate comparison of all the plans in your area and help you find the one that's going to be the best for you. Once you decide which plan you want and you find out which one's going to offer you the best deal, we can actually help you with all the paperwork right over the phone in just a few minutes. So whether you just have a simple question, you're ready to compare quotes, or if you are ready to apply for your new coverage, just please feel free to give us a call. We know after so many years of working with Medicare just how confusing Medicare really can be. It can feel pretty overwhelming. So don't be afraid to ask for help. We're here for anything that you need. And I sure hope we get to talk with you soon and be able to help you with your Medicare coverage. But most of all, I just really appreciate you coming on the webinar today. So have a great rest of your day, and we look forward to speaking with you soon. Bye-bye.